The nervous system coordinates the body's movements and the rest of the systems of the body through electrical signals conducted by nerve fibers. Nerves can be broken down into sensory or motor fibers, with sensory nerves coming from the periphery and sending signals to the central nervous system, and motor nerves coming from the central nervous system and going to the periphery. Furthermore, these nerves can be further broken down into somatic or autonomic fibers. Somatic fibers are conscious sensation and movement, and autonomic fibers are unconscious sensation and movement. The focus nerve of this video is cranial nerve number 5, the trigeminal nerve, which has both somatic motor and somatic sensory nerve fibers. The trigeminal nerve is the largest of the 12 cranial nerves. It's responsible for sensation in the face and motor functions. The combined nuclei for the nerve span the entire brainstem, with nuclei in the midbrain, pons, and medulla. The trigeminal nerve sends signals to and from 4 nuclei. The mesencephalic nucleus, situated in the midbrain, is a sensory nucleus. The principal sensory nucleus, situated in the pons, is a sensory nucleus. The spinal nucleus, situated in the lower aspect of the medulla, is also a sensory nucleus, while the motor nucleus, situated in the pons, is a motor nucleus. The trigeminal nucleus is the principal somatic sensory target for all cranial nerve somatic sensory fibers, and the 3 sensory nuclei have their somas in the trigeminal ganglion. Before reaching the trigeminal ganglion, there are 3 branches which send information to the trigeminal nuclei. The branches are the V1 ophthalmic, V2 maxillary, and V3 mandibular, with the V1 and V2 branches being sensory and the V3 branch with both motor and sensory fibers. Looking at a top-down view of the skull interior, we have the V1 ophthalmic branch, which enters via the superior orbital fissure, runs through the lateral wall of the cavernous sinus to the middle cranial fossa. Before the superior orbital fissure, it has 3 main branches: the frontal branch, which picks up sensations to the forehead, scalp, frontal, and ethmoid sinuses; the nasociliary branch, which picks up sensations from the upper eyelid, cornea, and dorsum of the nose; the lacrimal branch, which picks up sensations of the lacrimal gland. V2, the maxillary branch, enters the skull via the foramen rotundum and runs in the interior direction. Before the foramen rotundum, it was split into 14 branches. It picks up sensations from areas like the skin of the cheek, mucosa, upper lip, incisors, and teeth in the maxilla. V3, the mandibular branch, enters and exits the skull through the foramen ovale and divides into 4 branches: buccal, inferior alveolar, auriculotemporal, and lingual. Area of distribution includes mucous membrane, oral cavity, lower lip, chin, and interior 2/3 of the tongue. The motor component of the mandibular branch innervates the muscles of the first mandibular arch, the temporalis, lateral and medial pterygoid muscles, the masseter muscles, which are responsible for mastication, as well as the tensor tympani muscles in the ear, which is housed above the osseous canal to dampen noises such as chewing, and the tensor veli palatini muscle, which tenses the soft palate to prevent food entering the nasopharynx when swallowing. It is the only palate muscle not innervated by the pharyngeal plexus. Clinically, if a patient presents with masticatory muscle paralysis and/or loss of pain, temperature, and touch sensation over the face, it will have likely come from damage to the trigeminal nerve. Damaged tissue, such as tumours or cells damaged from trauma, can create lesions. If these occur in the brainstem, the trigeminal nerve can be affected. If lesions occur in the lateral rostral pons and above, it can cause loss of pain, temperature, and touch sensation in the face ipsilaterally. If lesions occur in the mid-pons, it can cause masticatory muscle paralysis and loss of pain, temperature, and touch sensations over the face ipsilaterally. And if lesions occur in the lateral inferior pons or lateral medulla, It can cause loss of pain and temperature sensation in the face ipsilaterally and occasionally contralaterally. Trigeminal neuralgia is also a significant disease arising from demyelination of the trigeminal nerve. This is thought to occur due to neighboring enlarged blood vessels wearing away the myelin sheath. Symptoms are episodes of nerve pain in the face, which can range from sudden stabbing pain to a constant burning sensation. It is said to be one of the most painful conditions and is often referred to as the suicide disease. Now you know the power of the trigeminal nerve.